Good evening, ladies and gentlemen, and welcome to Kirklees Council's Community Buildings webinar. Really nice to be speaking to you again. It seems ages since we last spoke, and in fact, it was back in last summer. My name is Joanne Bartholomew, and I'll be chairing your meeting this evening. So I'd just like to introduce some of my colleagues to you, and then we'll get going. So, Jonathan, would you like to introduce yourself?
Hello there, my name is Jonathan Quarmby. I'm the Corporate Facilities Manager for the Council, so we look after community buildings that the Council owns and support other buildings as well.
Jane, would you like to introduce yourself?
Good evening, I'm Jane O'Donnell, Head of Health Protection in Kirklees Council Public Health.
Emily?
Hello everybody, I'm Emily Parry-Harries. I'm Consultant in Public Health and I'm Head of Public Health for Kirklees Council.
Jill?
Evening everyone, I'm Jill Greenfield, Service Director for Communities and Customers, Kirklees Council.
Lisa?
Evening everyone, I'm Lisa from Local Services to You. We manage the Chestnut Centre in Deaton and a smaller building on New Hay Road, Focal, and amongst others.
David?
Hello everyone, I'm David Roach. I'm the Town Halls Manager for the Council and I also have responsibility for the community buildings.
And completing everybody who's on camera this evening, Sue?
Hello, good evening everybody. I'm Sue Proctor and I'm the Service Director for Environment.
Right, well, thanks everybody for introducing themselves. As I said, I'm Joanne Bartholomew and I'm the Service Director for Skills and Regeneration. We first held a webinar back in July 2020 and who knew we'd still be here at this point in time. And our second one was in September with over 500 views and we really value your feedback and comments. Some of you have previously sent in questions that we'll do our very best to answer today. If you have a question or a comment, if you can type it into the chat as you're watching, we'll make sure that we address it either as part of this webinar, and if we can't, we'll get back to you as soon as possible. It's just over a year since we passed start that again, Joanne. It's a year since we've been in the first lockdown. So we really want to take this opportunity to thank every single one of you out in the community, trying your very best in difficult circumstances to keep things going. And we want to help you get off to a great recovery as we move through the government's stages of recovery. So what we want to do is make sure we move on and give you enough information. So first, I'm going to turn to Jill and I'm going to ask Jill to give us a little bit of update from her area.
Evening everyone, as I've said, it's really great to be here this evening. As we've already talked about before on these webinars, that overall the community response has just been absolutely marvellous, and that work has continued throughout the district, and we've continued alongside yourselves to build really resilient communities. And it's really important that our community organisations are a centrepiece in that recovery as we move forward. We really want to work alongside our community organisation so we can continue that work and to support and protect our communities against COVID. We've already built some brilliant relationships and we really want to carry on building those, strengthening those and strengthening our links with the Voluntary and Community Centre, our anchor agencies and our hubs as well. A lot of the work that we've done across our VCS and anchors and hubs, it has been all in partnership with you, and a lot of that work has been around how we provide that visible reassurance on how we can stay safe. I'll just give you a couple of headlines in terms of the enormity of the work that's been done, and by no means have we managed to capture all of it. But we do know that over 7,500 people have made contact with us through the Community Response Helpline since we started that in the 25th of March 2020. We've also worked alongside our volunteers, third sector leaders, our mutual aid groups, and everybody in communities, so that we can so we've been able to ensure that our residents have been able to get the support they need during this crisis. really working to make sure nobody went hungry, nobody was lonely, and everybody got the things that they wanted. A couple of updates since then, and again, this is by no way exhaustive at all. We do now have a Community Champions programme, and that programme is a government programme that was launched just before Christmas in terms of the submission. But we actually got notification we were successful to run that. I think it was February, and we've already funded 12 local organisations to support the vaccination programme. A lot of our community organisations have been involved in that programme, as have been supporting the vaccination programme. We've also continued with a number of small grant programmes to make sure that's available to anyone who wants to support their local community to access the vaccine, and also give priority to locations where we have lower take-up. I know that some of you have also been involved in the brilliant work around supporting patients to get their vaccine through either the transport or actually making sure there are some community venues available to support passing on those messages, and where we've been able to do that in support groups in COVID secure community venues. And I know that that raft of work continues. So it's really important that we continue to work together as we go through these next steps, because there is such good work to build on. But that's it from me. Thank you.
Thanks very much, Jill. Quite a lot has been going on, hasn't it? And I'm certain that over the next few months, we're definitely going to need all our community organisations to work with each other and ourselves and the community. Emily, I wonder if I could ask you to give us a little bit of an update of what this current state and play with is with the facts and figures.
Yeah, certainly. Thanks, Joanne. So I'm going to give some facts and figures in two sections. I'm going to talk about the level of virus that's circulating in the population, and then I'm also going to talk about the vaccination programme. And then it wouldn't be an input from me if I didn't spend a bit of time reinforcing some of the public health messages as well. So I'll pop a link in the chat to the public dashboard, the public facing Tableau dashboard. So you can access that outside of this meeting if you wanted to have a look at some of these figures in some more detail. So we are now at a number of confirmed cases in Kirklees, 33,641. 295 of those cases have been confirmed in the last week. So we are seeing now a week-on-week drop in the number of cases of COVID in Kirklees. Our weekly rate of infection is now running at 67.08 per 100,000, which is a really significant drop on where we were previously. It's nearly a 12%, 11.5% drop in cases in the previous week. That does still leave us ranked fairly highly in terms of local authorities. We're currently 8th out of the 149 local authorities in the country. But what we do increasingly see as the numbers get smaller, we see ourselves kind of bounce in and out of that top 10 because it doesn't take much for you to move up and down the rankings. But the really good news is, although we would rather not be in the top 10, we moved into the top 10 in a week where we saw nearly a 12% reduction in the number of cases. But if people want to look at those figures in more detail, as I said, I'll pop a link in the chat. The vaccination programme is running really well in Kirklees, and everybody who's involved in the vaccination programme should be incredibly proud of the work that's being done. We've seen 192,000, over 192,000 residents now have received their first dose of the vaccine, and the pace at which that's been delivered has just been quite incredible, really. So if any of you have been involved in that in any way, thank you for your support in doing that. Part of the challenge of it now is going to be maintaining the pace and keeping going as we move down through the JCVI age categories. The vaccines being offered at our large vaccination centre, the John Smith Stadium, We are bringing a whole range of new pharmacy provision on board, and it continues to be delivered through our local NHS services and our GP surgeries as well. We're increasingly using pop-up vaccination clinics or roving clinics to access those populations where we know uptake hasn't been as high as we would have liked it to be. We've seen a couple of those now happen within mosques, which have been quite successful. And we've been doing some very specific targeted work with the White House Centre and the Methodist Mission in Huddersfield to work with our asylum seekers, roughly who has insecure housed populations, to ensure that they can access the vaccine. And as I've already said, I'm incredibly proud of how well the vaccination programme is going. The last thing I want to say is just take the opportunity to reinforce those public health messages that remain incredibly important. So my colleagues that come after me will talk about the practical issues of sharing physical space with people. But if we can all please continue to remember the importance of social distancing, the importance of hand washing, of really good hand washing, soap and water. If you haven't got access to soap and water, then alcohol, hand gel. The use of face coverings, really, really important to protect other people. And then lastly, the importance of ventilation. And thankfully, we're moving into a period of hopefully warmer weather. So having the doors and windows open shouldn't be as much of an inconvenience to people as it might have been otherwise. But ventilation and maintaining airflow when you are sharing spaces, particularly spaces with those with people who you don't usually live with, is really, really important. That's all from me. Thanks, Jo.
Thank you very much, Emily. Jane, I wonder if I could ask you to give a little bit of an update, particularly around infection prevention and control. And I know how difficult it is for us to find our way through all the changes in regulation and guidance. So can you give a bit of an update?
I can, of course, Joanne. Yep. So obviously, as part of when services are looking to reopen, obviously we want a meaningful COVID-19 risk assessment to be completed. And in that, obviously, there will be the main IPC issues should be included within that, which are obviously looking at, as Emily has touched upon, hand hygiene, looking at obviously ensuring that we've got may have hand sanitizer on entry to that building, ensure that we have signage up that people are frequently doing hand washing with using soap and water, or again, if we've not got access to use the alcohol and hand rub. Obviously, as well, we want to ensure about people wearing face coverings in buildings, and we know in some buildings it's actually it's a legal requirement to actually wear a face covering unless you've got a medical exemption. Obviously, when you're exercising, it can be removed. We wouldn't want anyone to be causing them respiratory distress with wearing a face covering. As Emily also touched upon, social distancing, that is part of obviously the COVID-19 risk assessment. We want to ensure that the space that we're sharing, we're trying to keep as safe as possible. Again, using signage, may actually have to put tape on floors to actually outline what a 2 metre distancing is, and also may have to introduce one-way systems as well. That's not always possible in some buildings, so obviously you may have to look at other mitigations to try and reduce that sort of, to prevent crowding. So might have to look at managing arrival and staggering people when they're actually leaving the buildings. Adequate ventilation, we know that obviously in the summer months it's good, we can open our windows, but in the winter months we tend to obviously pump up the central heating and close the windows, but having a circulation of fresh air is so important. And that's another reason why we obviously want to keep to the 2 metres, because you know, in some buildings you can't get the windows open, you can't get that flow through of air quite as much ventilation as you can in some other buildings. Also looking at ensuring that people take part in NHS test and trace, even showing the NHSR QR code where people can actually zap in using their app, or obviously taking the details of individuals and ensuring that you keep those details for 21 days and they do adhere to general data protection regulations too. I think, you know, the most important things is to ensure that you communicate, you train. We also have to look at cleaning. Obviously, during COVID-19, we want to ensure that frequently touched surfaces are cleaned more. We want to use products what have a detergent and a disinfectant, which to obviously so that they're effective against the coronavirus, which is an enveloped virus. So obviously that needs to be addressed when you're looking at services. Have we got the right cleaning products to use? Obviously ensuring you use, if you obviously using a detergent and you're actually making it up with soap and water, you're actually using disposable cloths as well. I think those are the main things to mention from an IPC. Other things to obviously look at as regards your risk assessment is encouraging people to use the rapid testing twice weekly. Obviously, that is to protect, obviously identify high viral load, and obviously then reduce the risk of transmission if someone tests positive. I would say that's probably the main things that I wanted to say, Joanne, unless anyone has popped up any questions.
No, I think there might be some questions later that I'll need you to answer, Jane. So, but we'll come on to those in a bit. Jonathan, you run and manage quite a number of community buildings on behalf of the council from an assets perspective. Is there anything you can tell us around how we're going about reopening those and our expectations?
Yeah, thanks, Joanne, and thanks to all the previous speakers as well, because that's neatly led me into this bit. So I think the first thing is that what we do in assets links very well with the next speaker, David's team, in terms of bookings. And we've been working closely together on, and we will be continuing to working closely together on how we actually open up the council's community building assets. As Jane and Emily's just alluded to, the first thing that we'll be doing is refreshing the COVID building risk assessments. So that is things like looking at signage in the community buildings, looking at where the hand sanitizers are placed at the entrances and exits, looking at the one-way systems, looking at the occupancy of the rooms, etc. And it's through the booking process that this COVID building risk assessment will be shared with any hirers of any community spaces. And then, as Jane said, it's down to the community users, the hirers themselves, to overlay that with their own risk assessment of their activities. And I think it's really gelling those two things together that's the really important thing. The buildings will be set up as closely as possible to be COVID secure, but that can all be wasted if the users don't respect and undertake their own risk assessment of their activities at the same time. So it's really important that they gel. As you said, Joanne, we have quite a large number of community facilities, not just the traditional community buildings, but also things like changing facilities associated with sports pitches, pavilions associated with bowling greens, etc. So we've got a large number of buildings to look at. And as well as looking the COVID risk assessment, we also have to make sure that the buildings are generally safe from a risk assessment point of view. So it's things like making sure that the water quality monitoring is up to date, that the fire alarms are being checked, etc. So it's much more than just doing a COVID building risk assessment that we need to refresh. And that's before we can consider taking bookings. And that will be a process that we will gel with David's team in the Town Hall bookings team so that they know when buildings are ready and available for hirers to actually book. And I think that was it for me.
Thanks, Jonathan. I think it is really important because quite a number of our buildings, as well as buildings that are owned by some of the people that are watching, and I'm actually really pleased that there's over 70 people watching at the moment. You will have to go back and think about all the things that you regularly did that you haven't done for quite some time. So a useful reminder there about water quality and fire extinguishers and all that sort of stuff. David, I know because you've been telling me previously that a lot of our hirers are keen to come back into our buildings. Talk me through how you're going to go about that.
Okay, thank you, Joanne. Yes, as you say, we're acutely aware that some of our hirers are very keen to get back, and I think that well-being is an absolutely key reason for this. People are keen to get back to normal and to engage in community activity. As Jonathan's just said, and to reiterate his really good point, we need to take a coordinated, measured and a controlled approach to opening up. So we need to basically build up resource and to ensure, for example, that we've got appropriate cleaning regimes in place in the community buildings. And that might mean that we aren't necessarily following the government's roadmap to the exact date, because I think we're taking a cautious approach to the roadmap. And as Jonathan's alluded to, our approach is very much a phased one, because we want to ensure that we're keeping people safe. So really, we're not at present in a position to give a firm date in terms of when people can return to the council's community buildings. I mean, I think an absolutely key point to make is that many buildings are being used for the forthcoming elections. So I think it's fair to say that certainly some of our community buildings definitely won't be available for hire and for use this side of the elections on May the 6th. As more than one colleague's already alluded to, risk assessment is absolutely key to this whole process of opening up. Not just the building risk assessments that the council does, but the risk assessments that the actual users and hirers of the facilities will do in order to be able to safely carry out your activities in a COVID secure manner. And actually a lot of groups we know, because you've sent them in and it's appreciated, have already completed risk assessments in anticipation of these measures coming into play. I'm also aware that some organisations, there's a national governing body that's been able to support you with this, and they may have issued their own guidelines as well. I think it's important to point out that multi-occupancy buildings, for example, where we might have more than one group actually in the building at the same time, does add that layer of complexity, and that's something that we want to work with groups on over the coming weeks, and actually have those conversations and those discussions. And actually, I think a forum such as this for particular buildings to bring together the building users that use our facilities, and actually just get a really clear understanding of how we're going to all work together to ensure that you can fulfill your activities, but also so we can keep you safe and you can keep yourself safe. So we will be working with you on this, and we encourage you to work together with the other groups that use the building you operate from. In terms of cleaning, which has been touched on, obviously Jonathan's talked about the corporate sort of cleaning approach that will be taken, but we're going to obviously be encouraging people as part of their risk assessment to wipe down those frequently touched surfaces, and actually to clean things like door handles and plastic chairs and so on. And it's certainly in the council run buildings, we're looking to provide packs of products to enable you to wipe down and actually clean between bookings, and we would build in extra time to enable you to do that. And I think the really key point, which has been made again by previous colleagues, but we really need to be clear about it, is that room capacities are based on 2 meters social distancing. There's a very valid scientific reason for this. So it's very important that activities maintain social distancing of 2 meters, and obviously we will work with groups on this. So I think the key thing is that we are listening to talk to you, and we will talk to you, and we want to get you back as soon as we safely can do so. I think
Thanks very much, David. There are a couple of things there that I think are really important that I want to reiterate, because I do know that we had some questions. One is that any building that we would be likely to use for the elections, we're not able to open prior to the polling day on the first Thursday in May. So I do know that there'll be a number of groups who are wanting to come back into some buildings, and we're not able to open those buildings for anything until after the election. That's to allow us to have a very safe election It's the first time we've done a COVID election, so we want it to go really well. Also, we do have a number of facilities that are being used for testing stations at the moment, and they're not available for use as community facilities either. And the final bit that you said that I want to reiterate, David, is that if you are a community group that uses a building alongside other community groups, and it's one of our buildings, we will be bringing you together to talk about how we can all live and work together happily in a space, because it's going to be very tricky, I think, for some users to be able to occupy the same amount of space for the same amount of time and building cleaning and stuff, and you want to hold some meetings to do that. Well, somebody who's been managing all of this very bravely all the way through this is Lisa. And Lisa, I wonder if I could turn to you now, because you've been living and breathing this for ages, and you're our resident partner expert on all things funding and help and stuff. So have you got anything to offer us this time?
Yes, for anybody who watched part 1 or part 2, I just thought I'd let everyone know our walkie-talkies are going strong, and if anybody watched will know what I'm talking about. We have purchased some plastic screens which have been really great. So you know the pop-ups that you take to events that roll down and you put in your little bag? Well, we've got some clear ones that we just pop up, so I think they were £40 each. They've worked great when we've had to have some face-to-face interviews or meetings, and we've just put them in front of people. Purple Dog have got similar ones in their rooms, and it just makes some people feel a lot better. I would reiterate again the time as the groups are coming in, the time that you have to spend together. And I think after every sort of stage, there's a rush of people. Can I come back? Can I not come back? Here's my risk assessment. Can I start tomorrow? And it's just about taking a step back and making sure you've got the time and the plan to do it properly. Some people have mentioned insurance. I think you're going to cover that, Jo, aren't you? There is various small pots of funding, a lot of which are there till June, that we've accessed for additional cleaning costs, PPE. They're very small pots, but they do help. So I don't know the best way to get that out. We did get some from a charity called Loose Change. That was a good one, and it was a really quick 48-hour turnaround. There's, I think the coronavirus emergency fund's still there from one community. I think that's till the end of June. So it's definitely worth having a look out. I don't know if you want to put my email in the chat. People can email me and I can give specific advice as to which pot to go for. Because we're such a large group of companies, we go for so many different pots. So it might be best to do that, but we're willing to do that.
Thank you, Lisa. That's really great. And please do stay on, because I'm certain there'll be some questions for you. And finally, Sue, I do know, because we've had it on our social media over the last few weeks, that we've been supporting some businesses with some PPE and various things like that. Is there anything that we can offer for the community organisations?
Yes, I mean, in advance of the 12th of April date, when non-essential business could go back to, the retail business could go back, and outdoor pubs could open, we've been distributing free packs of PPE that are appropriate to the businesses themselves. So predominantly face masks and hand sanitizer. And we'd like to, include our groups that are using our community building in that offer as well. So we would look to be able to coordinate that through through David at the point of booking, so that we can offer that support as well, so that we can continue to ensure that our customers, your customers, are safe whilst you're within the buildings. But obviously that will be led by risk assessment, so we need to understand what the activities are so that we can make those packs the most appropriate. So that's something that we can work out as we have that conversation with you. So it's understanding what the needs are, and then we can make it the most appropriate.
So thank you very much for that, Sue. I mean, I do know that a number of the businesses have found them really useful and helped them understand a little bit better about what the type of things that you need. I do know some of our community groups recovered between the last 2 lockdowns, so they might have some things, but definitely anybody should get in touch that needs that. So what I'm going to do now, ladies and gentlemen, is I'm going to move on to the pre-sent in questions. So that's fair warning. If any of you have got any other questions, to get them typed into the chat, so that Ben can get them over to me. And I'm going to open some of the questions that we've got up to the panel for advice and guidance. One of the first questions that's come from Lisa at Third Sector Leaders is around holding an AGM in the village hall in person. Now, I know we've been, there's some really clear rules around in person, inside and outside. And I'm going to say it before Emily does. Our advice and guidance to you is to hold things outside wherever possible. Yeah. So whilst the sun is shining, and it's likely to be shining for another week or so, our advice is to try and do everything as you can outside. And I do recognise, though, that some activities can't be held outside. In essence, you stand, I am correct, aren't I, Emily? You still can only meet indoors in groups of 6. That's correct for this particular activity.
Yeah, that's right.
Yeah, so you can hold a village hall, you hold your AGM at this stage in the recovery map. So this is stage 2 now, indoors with 6 of you. You could hold it outdoors. You could use some technology, so you could have some people present and some people on technology to be able to do that. You also, I do believe, can get dispensation to postpone things like AGMs in this context. And unless you had some, go on, Emily.
I was just going to say, I would be tempted in your particular situation to look for the dispensation to delay it a little while, so that we're in the next stage of the roadmap, because I think you'd be in a better position for bringing people together indoors.
Yeah, thank you, Emily. Then I've got a number of questions that a number of people have asked around things like, can I restart my dementia group? What constitutes a support group? Have the rules on support group changed, etc., etc. So support groups are, it's not that easy to get your head around, so bear with me while I bring up my piece of advice that is in front of me on a piece of paper. So in terms of a support group, you have to be a support group that is what we would say is properly constituted. So the easiest way to describe that is you have been commissioned by another organisation, or you as a business, as part of your business model, provide support to people in a number of different categories. And what we'll do is we will share the link on the particular guidance to you all as part of this. But basically, a support group must comprise of things that provide support to victims of crime, including domestic abuse, those with or recovering from forms of addiction, those with or caring for people with long-term illnesses or terminal conditions, or people who are vulnerable, particularly with mental health issues, those facing issues related to their sexuality or identity, people who have suffered bereavement, vulnerable young people, including the ability to support them to meet with youth workers, and disabled people of any age and their carers. What it doesn't, a support group isn't, is a few of you deciding to get together and support each other. That does not make a support group at this stage in the roadmap. That would not be covered unless you were doing that outside and there was less than 6 of you, in which case you would be covered by the current stage 2 of the recovery guidelines. You can, if you believe that you are running a support group, you can have up to 15 people inside to do that, but only if the space you are using allows for that to still be done under social distancing. It's not up to 15 people, and it doesn't matter the size of the space. The size of the space matters as well. And as I think Lisa said on a previous webinar, do not underestimate just how much space you need for bigger groups of people. It's quite surprising how much space. We as a council are still advocating that you work on 2 metres. We do recognise that the government guidelines allow you to work on 1 metre plus, but in doing so your risk assessments become slightly more complicated around things like ventilation, etc. And that's really tricky, isn't it, Jane? Jane, I wonder if I could just bring you in at that point, because we have taken a decision, haven't we, to sort of continue with the advice and guidance around 2 metres to support that ventilation point.
We have, yes. Yeah. And science does show that obviously the coronavirus can travel up to 2 meters.
Yeah. So in terms of what is a support group, I think I've laid it out quite clearly for you there. And you can meet indoors. We would still advocate you meet outdoors, but only if the space allows you to meet to that size of things. We've got a little bit of a question that I'll take because it's relevant. Could we comment on what social restrictions might be required in stage 4? I don't know, and I gave up a long time ago trying to second guess any of this. So all we try to do is work with what is currently in front of us and give you some advice and guidance. If as we get nearer to stage 4 things change, we're really happy to have another webinar because we all love doing this. So we've got a question now about cleaning. So I probably think this probably sits between you, Jonathan, and Jane. So Moor Green United Reformed Church had a previous cleaning regime, which was a twice weekly clean. Jonathan, could you just reiterate the type of cleaning that we're doing in our buildings? And Jane, then if I could ask you to just clarify why we think that's the most appropriate.
Yeah, thanks, Joanne. I think as Jane alluded to in her first piece, really, the cleaning is the product that we use is a Claw Clean product, which is a combined detergent and disinfectant, and it generally lasts around 24 hours. So we have a COVID clean on a daily basis with the Claw Clean product. But then, as David alluded to, between hirers, we will be expecting hirers to both wipe down at the end of their session, and that would be using one of the sanitizing wipes to clean high touch areas, down tables, etc. And then the next hirer that's coming in prior to their session starting, again to wipe down high touch areas so that we've got all the high touch areas cleaned and sanitized, basically using the appropriate product. That's essentially it for the Claw Clean process. Don't know if Jane, if you've got anything to add.
No, I think it's just important to say that obviously when you use the wipes, that again, that they are the correct wipes to use, which are bactericidal and vericidal. I know that we've had to give advice to people when they've actually just purchased an alcohol wipe and they're not effective against an envelope virus, which is the coronavirus.
Okay, so Jane, you are happy if anybody wants any advice on what are the right things to purchase to give them that advice. And I do know in the packs that we give out, so we only give out the right things, the things you should be, not necessarily that particular brand, but the type of thing that you should be purchasing.
Yeah, quite happy. The IPC team are quite happy to give advice, and I know they have done in the past to some of the community groups and also, local businesses.
Thanks, Jane. I would just want to reiterate what Jonathan said there, because I think it's a very important distinction. So we clean our buildings every day. That's because they're our buildings. So if you own a community building, you should clean it every day. We also require people who use it for sessional use to clean it before they use it and after it. And I think you should do the same. It should be in their risk assessments that they should, as part of their risk assessments, they should never assume that something's clean, and that so they should clean before they start. So we can obviously give further advice on risk assessments. I know we gave some out last summer, and to be honest with you, I think that still stands now, but quite happy to send out some further sample risk assessments if anybody needs any support with that.
Joanne, sorry, to mention,
Jane.
we can also send out the guidance on cleaning in non-healthcare settings as well, which people may find useful as well.
If we can do that, because we just had a little question comes in, which is, what is the Claw Clean product? It's Claw Clean, Claw as in chlorine clean product, and it's a particular standard of product. John at Moor Green, we will make sure that we send out some advice and guidance on the right products to use whilst you're keeping your building clean. So we've got a question now, and I think probably back to you again, Jane, around refreshments, and can we use refreshments? And this, again, at this stage in the recovery roadmap, is a little bit complicated, isn't it?
Yeah, refreshments can't be served indoors, But if somebody wants to serve refreshments, they can be taken outdoors. But if people want to bring in their own bottled water, that is not a problem, or a flask. But you can't actually serve refreshments indoors presently at this stage in the roadmap.
Yeah, and also if you wanted to serve refreshments outdoors, they should be served to the table. People shouldn't queue for those, should they?
No,
No.
Should be
Okay.
table service.
Thank you. Got a bit of a question here around the support groups, and thank you for that, Michelle. You've actually reminded me of something that I meant to say, which is that support groups include the attendees, but if the attendees are bringing their children, they're not included with that. That's correct, Michelle. So you are correct with that. But again, if they're bringing extra people, you need more space. So you would need to know how many people were attending and who they were bringing with them in order to be able to have the right amount of space to be able to deliver that.
And if you've got space to do that outside, please do it outside if you possibly can.
Do it outside if you possibly can. Absolutely. So Susanna from Aspire is saying they don't have their own building, but they rent rooms in a variety of community buildings. Is there a template for them to send out to get procedures, etc., to restart their groups? Sounds like they're sort of dealing with the type of world we're dealing with at this moment in time, where activities taking place in different venues. Jonathan, have you got any advice and guidance for what you would expect them to be needing from, say, us if we wanted them to hire?
Yeah, no problem. Susanna, I think the types of questions you need to be asking when you're booking a venue is, can you give me a copy of your building COVID risk assessment so that you can then add and overlay your own risk assessment of your activities over the top of that? And also, can you reassure me that you've done all the other health and safety checks in a building that would typically be done when buildings are open as normal, things like fire safety, water quality, all those kind of activities? And then I think we've got a question later on about insurance, and that will be the other question I'll be asking about insurance, but we'll probably cover that under the other question, Joanne, if that's okay.
Absolutely, no problem. So I'm going to move on to a question from Becky at Third Sector Leaders. Again, this is around vaccines and lateral flow tests. So probably one for you, Jane, or perhaps for Emily. So what Becky's asking is, what sort of advice and guidance can we give her where she's got staff or volunteers that are providing services to people around whether they should or shouldn't have the vaccine, the staff or the volunteers, or whether she needs them to be able to have a lateral flow test? I think this basically comes down to their own risk assessment, doesn't it?
It does, Joanne, and I think, depending on the type of activity, the vulnerability of the individuals that they're actually providing that activity for. And I suppose it's having that conversation to understand why they don't want to have the vaccine, if they feel that they could have that conversation, to then obviously advise them to have a conversation with their GP or, community pharmacist about the actual vaccine. As regards lateral flow tests, again, it's and obviously encourage people. It's another point for risk mitigation. But if somebody obviously has made that decision, they don't want to have it, then that should be part of the risk assessment to make the decision whether that individual can actually provide that activity for that individual.
Yeah, I do know in care settings, people who are not accessing lateral flow testing are not placed in certain circumstances where they're supporting extremely vulnerable people. So just to reiterate what Jane said there, your risk assessment overrides all of these things. A bit of a question now on insurance cover, and Lisa did touch on it in her opening, but Jonathan, insurance covers quite a complicated world, isn't it? And I think we do have a number of groups who are wondering whose policy covers what. Have you got any advice and guidance?
Yeah, thanks, Joanne. I don't think it's changed since pre-COVID, to be honest, the insurance arrangements. So if you're hiring from the council, if you're hiring a space from the council, you'll be covered under the council's general insurance policy for general activities, so non-high risk activities. So if you're a book reading group, you'd be fine. If, however, you were undertaking a welding class or something like that, then you would need to have, I can't think of another example, sorry. But you would need to have insurance to cover that activity. And that more can be explained during the booking process if you've got any real concerns. So I suppose the point is, ask the question if you're at all concerned about it.
Yeah, I would imagine, and I know myself and Lisa spoke about this earlier, that there is a concern as to whether or not they're covered if somebody contracts COVID. I think our advice and guidance to you is that if you're worried that your activity increases the risk of COVID transmission because you can't keep it safe with a risk assessment, do take some advice and guidance from IPC, and you might want to consider whether or not you want to do that activity at this stage in the roadmap. But actually you should be able to put some measures in place. I don't know about welding, and certainly I think Emily would be saying do your welding outdoors for definite. Yeah, so in terms of insurance, you should be covered in exactly the way you were previously. But if your worry is about would somebody contract COVID, you need to make sure that you get some advice and support on your risk assessments. We won't write your risk assessment for you because that belongs to you as the operating organisation, but we can give you some advice and guidance around what is appropriate, just as we're doing today around space and where, how and when to use things. Okay, so I've got a number of questions, some questions in particular about Gomersall Public Hall. Now, just remind me, David, I think that's one of our polling venues, isn't it?
I believe so, Joanne, yes.
It is. So I do know we've a number of questions around bringing back activity that was allowed since the 12th of April into Gomersall Public Hall in particular. This moment in time, as I said earlier, we are not opening any of our venues that are going to be polling stations because we're busy making them COVID safe, all 190 of them, to ensure that we have a really good election. We'll have a lot of people going in and out of those venues on those days, so we've really buttoned those down. However, I would imagine post the election that the multiple hirers of venues like Gomersall Public Hall, you'll be getting in a virtual meeting room, David, and working through some of those kinks, won't you? Because around, do you want to just reiterate what you'll be doing with that then?
Yeah, so basically our intention is to get where there's a building where we've got multiple users is to bring that group together to understand people's needs, to understand who's in when, who wants to be in when, and basically to work out a way of operating the building in a safe way and having that conversation, which means that everyone understands what everyone else's needs are and what everyone's responsibilities are in terms of cleaning and keeping the building safe. And I imagine we'll do it in a format like this. We'll do it in Teams or a Zoom and get everyone in the same room at the same time, so we're all on the same page.
Great. Francine from All Star Performing Arts has asked a lot of questions that I think you would answer in that particular thing around how would you use that building, a very building specific around how different groups will get in, how you will share if there are a number of groups in at the same time, how would that be managed around toileting and risk and something. So not wanting to duck it, but I think it's very individual to each group. I do hope, Francine, you've been reassured that there'll be an individual meeting around Gomersall Public Hall. What I would say though is that there's quite a few questions in there. We would still need you to have your risk assessment exactly the same as the Scouts in another building or a book club in another building or a whatever activity. You know, we would still need you to have your risk assessment for what you're operating. Things like one-way systems and signage and the building stuff is stuff that we will do. And also don't forget Sue's offer to support you with perhaps a little tiny bit of startup of PPE around that. And I do think we've covered off your questions around cleaning. I think it's probably, Jill, I wonder if you could comment. I think it is really difficult for community groups to sort of find their way back to coming back into this. Are you sensing any of that out in the community around how difficult this is?
Yeah, I think it's quite individual and quite different because some people, you know, have different resources. But I think the important thing is to remember, as Lisa pointed out and talked about, a lot of the offer of support that is out there to help community groups, either through third sector leaders or through the council community facing teams, and we can send out those hub leads as points of contact. It is variable, but it is difficult for people. So we are here to help. And as I said, Lisa's got some really good information and support to share, which is very relevant. Just listening to her earlier.
It is, Jill. And what I would say as well is, and I know I have mentioned elections, but one of the things that we are desperately trying to prioritise, because at the moment, for us to get all our buildings back and ready and support everybody who previously used any of our buildings back in is a really big ask. So we are prioritising those groups who support vulnerable people and vulnerable groups. So those groups that fall under the normal support group stuff. So some of you will undoubtedly be running activities that don't necessarily fall into that, and wherever possible, we will do our best to support you to get back up and in the venue as soon as possible. But our resource prioritisation at this moment in time is around those community groups that support vulnerable people, and that doesn't matter where they are across the district, it's around that. Jill, is there any sort of advice and guidance we can give to groups to help them understand what we mean exactly by vulnerable people, because it can be interpreted differently, can't it?
Yeah, I don't think we've got anything specific that we can send out. But again, what I'd ask people to do is have that conversation with us about what that actually means and who we mean. I think it is about something that is quite acute and is recognisable issue. I think when people were talking earlier, one of the questions around dementia, I think it's really difficult at the moment to be dead specific about that, but we can help and talk that through with you. But it is more than your ordinary emotional well-being, connection, support. But we can also talk to you about where you might be able to access some of that if that's the real concern, which I know it is for many groups. You know, we do have a really useful befriending partnership in Kirklees, for instance, that would be really helpful.
Okay, thanks very much, Jill. We've just got a question that's asking us if we can bring some meetings forward. I would reiterate, wherever possible, we will speak to you as soon as we can, but the services have been asked by myself, Jill and Sue and Jane to ensure that we prioritise those hirers that are recovering to support the most vulnerable, and we need to make sure where it's a multi-occupancy building that it's not necessarily first up, best dressed. It's actually around us understanding what's the right thing to do for the community that building serves and everybody that uses it. Okay. So John's asked me a question that says, you say polling stations will not be open before the date, but we're a polling station and we're open for some groups. That's because that's your building and not our building, John. So just to be really clear, where it is a council building, it is not opening ahead because we're getting all of those ready. That allows us that bit of capacity to, when we get to near the elections, to get to support our colleagues into buildings where we use community buildings. So I'll just make that point clear. So somebody's now asked a question around can they hire things out for private functions? I think at this moment in time, you can only hire things out within the guidance, and I don't believe the guidance allows private functions, other than you are allowed to have a wake, if I'm right, Sue. So you are allowed to have a wake. That's correct. So if you were hiring it out for something like that, you can do so at this stage. Later stages in the recovery may have different guidelines. What I would like to say, and one of my colleagues has asked me to point that out, is that whilst the 19th of May is the next point in which we expect that the government will move to the next stage of the recovery, it is the earliest date. It is not a guarantee that we'll move to that at this point. I've now got a general question from Sue at Home Valley Owls, David, which I think is one for you. And what I'm sensing from Sue's question is that as a group that supports over 55s with well-being and stuff like that, whilst they want to come back, they're not feeling confident around that and are wondering what our expectations are. I think our expectations are that they should come back when they feel comfortable, but have a conversation with us. What do you think? Oh, and David has inconveniently frozen at this point. It's not just frozen for me, has it?
I'm sorry, Joanne. Yeah, it's frozen. It froze for me as well.
Okay, David, we both froze for each other there, so apologies. So I'll reiterate the question. The question was from Sue at Home Valley Owls, who I know they do a lot of work with over 50. Oh.
I think if you could hear me, what I would say is we'll get in touch. We'll get in touch with the Owls, and we can have that conversation with them. If you can hear me, Joanne.
Yes, I can. I think there's a general point. If you as a community group are feeling that you're not quite ready, this all feels a little bit much, do get in touch with us. We might be able to give you some advice and support and reassurance, but actually what we don't want you to do is to think that we've forgotten about you. If you're not ready to return to your activities at this point in time, regardless of who they support, then that has to be absolutely the right decision for you. Okay, so I have got some questions around the census team. So Thornton Lodge, our community are currently community services from the 17th of May. So Thornton Lodge, again, I think we'll be having a meeting, Jonathan, won't we, about Thornton Lodge community building? I know it's one that we're currently using for an election, isn't it?
Yeah, it is, Joanne. So obviously we can pick that up after the elections on the 6th.
Yeah. What I would say to colleagues is, and Lisa said this earlier on her little bit, do not underestimate how much time it will take you to get yourself ready to come back in. So if you're wanting to bring your activity back fairly quickly, you need to get your risk assessment sorted. You need to look at, remember, we are not here to check your risk assessment. We'll give you advice and guidance, but it has to be yours. Neither are we here to write it for you. But you need to start thinking about that. You need to start thinking about the space that you would be using, whether that's suitable for those activities, how you're going to manage some of those social distancing. So in terms to colleagues from Thornton Lodge Community Service, you want to offer community services from the 17th of May, assuming that the government roadmap allows you to do that at that point, and assuming that that we're able to support you to use that building and your risk assessments are in place, then that could be possible. But I would encourage you to get on with it and do it, although I do recognise that colleagues in that community are fasting and therefore capacity might not be as high as it could be. We've got a question around using bowling pavilions as the leagues start next week, and particularly around use of toilets. You did touch on this in your opening, Jonathan, around us getting around and opening these sorts of things. Would you like to comment on that?
Yeah, bowling pavilions, it would depend which one, to be honest. Some of the bowling pavilions were drained down at the start of the season, at the start of COVID, from a water quality perspective. So we need to understand, because clearly the toilets would be, having water on would be key to the toilet. So we'd need to understand which bowling pavilion it was, and how quickly it was to bring on stream. I think we'd be reluctant to open the bowling pavilion up for anything other than toilets, largely because the size of pavilions are quite small and it's practically impossible to social distance. So I think, I'm guessing here, but I think it will be a one in, one out situation for a toilet situation rather than anything else.
there are all our public health and IPC colleagues are nodding at that point, Jonathan. And what I would say is that we would ask community groups where we're leaving them on trust to make sure those sorts of things happen, you know, that we're not using things inappropriately, that we're managing things on a one in, one out basis, so that we're keeping everybody safe. So I understand, Francine, that David's going to set up a meeting around Gomersall Public Hall, and I do recognise that you're concerned around the children that you support with the dance classes and performing arts. I myself am a big supporter of performing arts, and I do recognise what a valuable contribution it makes to things. So I'm certain that David will do his very best to support all the users of Gomersall Public Hall to get back in there safely and in a manner that helps everybody as soon as possible. Yeah. So in terms of business grants, we've got a couple of questions around business grants. What I would ask you all to do, and I will put an email in the chat for Ben to upload onto the thing, so for you all to message business rates to be able to ask that business grants for you to be able to understand whether you're eligible for a business grant as a organisation. If you've applied already for a business grant under this last round, they should be starting to come through at the moment, but Lisa can also support you perhaps with some alternative funding methods, as she said earlier, and we have put her email into the chat so that she can give you some individual support. There are a number of community organisations that can help you do that, but if you are trading as a business as well, you should be able to do that. Okay. Okay. Bowling Pavilion, Stanley Park. The Bowling Pavilion is Stanley Park, Jonathan. What I think we can say is that as soon as we can, we will start to open toilet facilities across the pavilions, but they have been closed for some time and they do require a period of asset management to get them all open and back and running. So I'm looking in the chat and in the list of questions as well. I can't see any I have missed. Can colleagues? No, okay. So on that basis then, what I'll just do is I will just sum up. So yes, so we have, sorry, yes, Jill, we have done the question for Home Valley Owls. It was the over 55s one that David was struggling with his connection. I just used it because I know what they do. I used a different shorthand for that, so apologies for that. So regardless of the date, the government's roadmap is in stages, so please get yourself ready for changes. We can't second guess what's going to happen in stages 4. We would encourage you to do your risk assessments, to get advice, guidance, support from business grants, from Lisa around what else you can apply for, from IPC around how you have a safe operating model for whatever it is. Remember, Emily would always want me to say, if in doubt and you can do it outside, do it outside. It is far safer out there, and we want to make sure that everybody keeps themselves safe. One of the things I would like to just remind everybody of is that lateral flow testing is available across Kirklees, and you can actually collect lateral flow tests now for you to do at home if you're an adult, to keep you and your family and your community safe, and potentially your business or your community group that you're supporting. They can be collected from any of the council's fixed sites and a number of pharmacies across the district at this moment in time. So you can get those and take home about 7 weeks worth of tests in one go and keep everybody safe. Do come back to us if there are any questions. As the government's roadmap evolves, we will come back to you and help and support you wherever we can. Thank you for bearing with us. I do recognise how frustrating that this has been and how hard it is as we start to recover for everybody to work their way through it. We will do our best, but one of the things is that not everybody will fit back in the way that they were previously into some of these community buildings. So we encourage you wherever you can to continue to work with us. And so on that basis, I'd like to wish you all a pleasant rest of your evening. And remember, take care, stay safe, and always be kind. Thank you very much.